Thank you very much, Professor Anurag. It's a pleasure to be with you all today, so appreciate the opportunity. And as Professor Anurag mentioned, while I've been involved with healthcare in many different ways, as an entrepreneur, as a tech entrepreneur, in my role in running the foundation, but today's session is largely wearing my hat as the chair of NABH and talking a little bit about how we think about accreditation and unlike the previous chairs who have all been very senior doctors, in this particular case, the NABH has a chair who is more of a business person and an engineer. So I'm going to give you a business perspective to why accreditation is important and being able to really drive the business of healthcare forward and make quality a reality. So before I start, I'm going to come over. So we have one more panelist, Neeraj, who has just walked in. So sorry. Yeah. So Neeraj leads a Path, which is one of the largest, not-for-profits working in the space of healthcare. So welcome, Neeraj. So if you look at, how many of you all have been involved in some form, fashion in buying a car? Can you all put up your hand? Many of you all would have, right, in our lives. Now, each of the cars has an engine. And the engine, with respect to today's regulation in India, has to be BS6 compliant. How many of you all can put up your hand and say you all understand the BS6 certification? The BS6 certification is very complex. It has emission standards for carbon dioxide, for hydrocarbons, for sulfur, for various sort of nitric oxides. It has standards for pollutants, the amount of carbon emission. It's a very technical standard. Any of y'all have any sense of what those standards are? Do you worry about it? And the reality is none of us do. Because what ends up happening is that there is a very well-defined standard, which is called the Bharat Standard 6. And car manufacturers are supposed to comply to it. And all cars which are sold are naturally compliant to the BS6 standard. So there is a complex standard for emission control for cars of all types. It could be a two-wheeler, four-wheeler, buses, trucks, whatever. But the buyer is oblivious of the complexity of the standards. Because what is sold in the market is certified and complies. So there is some body somewhere which goes to a factory or goes to an automobile plant and checks whether the engines are compliant, and they have to go through a testing certification process. And eventually they get a small logo or a small badge which says, yes, you are compliant. And millions of people around the country who have no knowledge of what it takes to come up with those standards actually are able to buy a car which actually meeting those standards. Now you look at what's happening in the world of digital health in India, and in fact it's a problem globally. That today we all talk all the right things about digital health adoption and why it is important to use technology to improve healthcare. But when it comes to actual procurement of that software or that system, we're expecting the end user, typically a doctor who could be running their clinic, or he or she could be running a hospital, to actually make a decision on a complex piece of software. They have never been trained on it. They kind of don't even know all the nuances of what it takes. The same thing as when we buy a car, right? And just trying to draw the analogy. And we're expecting them to go through every single detail before they do the procurement. So now you have a situation where if you look at digital health as a business, then the buyer has no ability to buy. And interestingly, the seller who kind of knows their product has no ability to sell. And the reason they don't have the ability to sell is not because they don't know their product, because they just don't have the ability to train the buyer to buy, right? So imagine, for example, if every car company had to sell you a car, first had to make you go through a 3-day training program to explain to you how the BS standards for emissions work. And then you would first understand it, and then you would go to buy the car, and then you would ask the car company to validate whether that particular system is actually compliant. And only then could you buy a car. Then buying the car would be so complicated that if you had a mechanical engineering degree, perhaps you could buy a car. Maybe electrical engineer could buy a car. But maybe if you're from the arts segment, it would require a big lift, because now all this technical jargon to matlab samajh mein nahi aayega, right? Now we are doing the same thing today in the healthcare industry. We are expecting every single seller to go out and communicate what they are selling and explain that to the buyer and train the buyer. What is cloud software? What is security? What is privacy? Now there are new jargons, DPDP Act. So everybody has got this sword of DPDP Act hanging on their head. And then they have to worry about so many other factors. And then we say, "Arey, digital adoption nahi ho raha hai." So nobody is able to sell. Hospitals are not using technology. So we have made the job of buying and selling software or digital tools so complicated that the buyer doesn't know how to buy and the seller doesn't know how to sell. So we need to demystify that. And we have to really make it easy for, very simply put, the buyer to buy and the seller to sell. If we can't do that, digital adoption nahi hoga. So what is the solution? You need an agency like the NABH which is able to demystify. So I have 2 slides. I'm going to share with you what we are trying to do at NABH, and hopefully all this background I gave you will make sense to you. Yeah. So what are we trying to do at NABH? Okay. So there are just pull this up. Okay. So this is a very important slide. Okay, and I have only shown this slide a couple of times before. So in a sense, it's net new information. So let me explain the slide. It goes from, first I'll explain A, then B, then C, and how it all needs to tie together. Okay. So NABH is a 20-year-old organization. Over the last 20 years, it has built a very mature standards for evaluating hospitals. So they know how to go to a hospital and they can look at inpatient, outpatient, admissions, discharge, billing, inventory management, all of that. They have procedures and guidelines, and they have come up with a nice big book which explains how it should be done, and they have thousands of assessors that we send to the field to go and check whether hospitals are following our guidelines or not. And when they follow the guidelines up to a certain level or above, then we give them a certificate or an accreditation. So A, which is the core standards, has been around for 20 years. What we did about 2 years back is we worked at NABH to develop the digital health standards for hospitals, which is that yes, you want to do all this stuff in A. What is it that you will need to do so that the systems can support you in doing what NABH wants you to do, which is A. So taking off all the requirements that a hospital needs. Oh, you need to do admissions in a certain way. You need to monitor patients in ICU in a certain way. You need to maintain this documentation. That drives what digital tools are required in a hospital to be able to achieve objectives of A. Okay, so far you're with me. What that is doing now, so we've got about 125, close to 125, 150 hospitals who are certified now, and we have 200 in the pipeline, so it's starting to pick up. It is giving direction to a hospital on what is the requirements for digital, and it's also prioritizing for them that these are the more important things, these are the less important things, because all NABH guidelines, if you all have seen those guidelines, define requirements into 4 levels, right? Core, commitment, achievement, excellence. It's a sense of priority, right? So imagine I'm running a hospital. Earlier, if you go to me and I don't have anything, I'm not a technology person. I'll say I want to automate everything. But automate everything actually means nothing. What the digital health standards for hospitals does is it gives you a framework to think about how a hospital should get automated and in what order it should get automated, so to able to give you the best results for your investments you want to make. You may not be able to automate everything, but you can automate a few things, then you prioritize this, then you prioritize this, and so on and so forth. Now, assuming that that is now understood, which is B, what we did last year, which is 2024, is that we developed the guidelines for electronic medical records and HIS systems, healthcare information systems. That imagine the hospital has to do all of this. What should technology companies build in their software so that the hospital can do this? Is that making sense? Actually, very simple when I say it, right? So now we have these 3 standards. They're all in the public domain. You can go and download it on the NABH website. There are 3 standards. You got a core standard, which is about 20 years old, which is A. You got the digital health standards for hospitals, what hospitals need to do, which is about give or take 2 years old, and it's starting to pick up. But now, most importantly, we have this 3rd standard, which is the NABH standard for EMR and HIS. The most interesting thing is they're all consistent. So what that means is that imagine if antimicrobial resistance is an important area, and if the NABH standard says, okay, before you give antibiotics, do these 3 things. Then the digital health standard for hospital says, hey, before you give antibiotics, make sure that the system is able to capture these 3 things. And the digital health standards for EMR is saying, if antibiotic is selected, then ask these 3 questions. Only allow the next button if the 3 questions are answered. So you are enforcing the discipline of antimicrobial resistance through your EMR. Now, if you don't do it like this, then you do the traditional way. What is the traditional way? You have to send thousands of assessors across the country, and then you go to each hospital, and then each hospital will then take a sample data, and then for the sample data you will check whether those 3 protocols were followed, and then you will determine whether your antimicrobial resistance is working or not working, which is so complicated and in today's world so convoluted that we don't really need to do that. Maybe we need to do it today, but perhaps not 5 years down the line, if all our solutions, which are being implemented in hospitals, are NABH compliant. Yeah. So the fact that we have an internally consistent, integrated approach, I think is very cool. And to the best of my knowledge, I think India is the first, probably the only country today which has this integrated approach between the core standards, the hospital standards for digital, and the EMRH. And I think that is very, very important. It's all very new. Of course, the evidence of many of these things and how it will get panned out will take several years. But I do believe that we have the right framework in place. Yeah. Okay. And then the next slide is also as exciting, and I'll share with you our overall strategy for how we are scaling this. So now what I spoke about so far is in the context of what I would call a general hospital. But reality is that healthcare is getting more very, very specialized. So whether it's cancer, whether it's cardiac disease, whether it's diabetes, so orthopedics, every department and every specialization is trying to build more and more sophistication. And it's really hard for one organization called NABH, irrespective of how good we may be, to become great in everything. It's not going to happen. So what we now have is a very systematic, structured partnership approach, where we are saying is that we will build the general standards for hospitals, clinics, and so on and so forth, but we will partner with the best of breed organizations to be able to build specialized standards. For example, we want to build specialized cancer protocol. So for example, what is the problem we're trying to answer? You're a cancer hospital and you've now got all this figured out, the general EMR, what it should contain, etc. But there are so many things you need. Only you'll need it for medical oncology or for surgical oncology or for cancer tumor boards or what have you. what if we can define the digital protocols associated with those requirements? Then we will create a add-on certification on top of the general certification, which will be NABHS cancer module. And we will not do it by ourselves as NABH, but we'll do it in partnership with the National Cancer Grid. What if we could do the same thing for cardiology? We haven't started working on that as yet. What if we could do the same thing on diabetes? We've just started working with, here we have Dr. Sanjay here from the RSSDI with whom we are collaborating for that. So the approach is modular and scalable. And what I would like is 5 years from today, for most different types of or important types of health conditions or specialities, we define a certification and accreditation framework which defines clinically obviously what needs to be done, but even digitally what we can do, so that we can drive the quality, we can drive accreditation to create standardized care pathways, evidence-based guidelines, and even do cooler stuff like healthcare. You want to do healthcare AI, guess what? If you don't have structured, high-quality data captured, you can't do healthcare AI. So a lot of this stuff will eventually drive a significant acceleration in the adoption of AI and other tools in healthcare. So I'll just pause here. Thank you very much. And hopefully this was interesting.